About that last conversation on HRT. As I said, if you send me the word HRT on the text 4001 or on messages 04871 5500, we will be coming back to that and I can send you the information that you need for our guests. Right now, though, we are talking DNA. And April 25th marked World DNA Day, a moment to reflect on just how far genetic science has come and how close it's getting to our everyday lives. Now, here in the UAE, there's been a major push towards genomics and preventative healthcare, with DNA testing becoming more accessible than ever before. And the idea is simple, to move from treating illness to predicting and preventing it, something that Sophie was talking about just a moment ago. But it raises big questions, because can a DNA test really tell you if you're likely to develop something as serious as cancer? How accurate is that information? And perhaps the most human question of them all, would you actually want to know? Now, I would love to hear from you on this. Would you take a DNA test if it could tell you your future health risks, or is it a step too far? Text me on 4001 or WhatsApp 04871 5500. Joining us now is Dr. Rahat Ghazanfar, consultant in longevity at Sheikh Shakhbout Medical City in Abu Dhabi. Dr. Rahat, thank you so much for joining me.
Thank you so much for having me.
Now, let's start with the big one. Can DNA testing now actually predict something like cancer? Or is it more about identifying elevated risk rather than giving us a sort of form of certainty?
Great question. So DNA testing can identify the inherited genetic variants. So most of us know as BRCA1, BRCA2 mutations or Lynch syndrome gene that significantly elevates the risk for certain cancers, such as your breast, ovarian, and colorectal cancers. But the phrase reliably predict, that needs nuance. Now, genetics is only one piece of the puzzle. Most cancers, as we all know, are multifactorial, meaning lifestyle, environmental exposures, aging, and the epigenetic factors. All of them interact with our genes. So DNA actually is just giving us a probability, not a destiny. Now, a positive result signals a higher lifetime risk. It does not mean a cancer diagnosis is inevitable. That's something which we need to really understand. And just as importantly, a negative result does not mean zero risk. Yeah. Now, the real clinical value of genetic testing lies in helping us stratify risk, personalize screening, and intervene earlier rather than predicting certainty. That's how I would put it.
Mm-hmm. And so for that, who are these tests most suitable for? Are there particular people or particular family histories, say, that should be pointing people towards trying to undergo some sort of DNA screening?
Now, that's a very valid question, because that's the question I get asked most frequently in my clinic. So now genetic testing is most valuable, if I put it in this way, is when there is a clear clinical indication. That's where it's the most valuable. Now, good candidates, in my definition, would include people with a strong family history of cancer, particularly among your first-degree relatives, early onset cases, or multiple relatives with related cancers. Now, the second one would be where patients whose physician has identified them as having a concerning pattern, or where certain results would directly influence surveillance or treatment decisions. Or the third category, how I describe it, is as families where there is a known pathogenic mutation which has already been identified. So those are your good candidates. Now, where we should take the pause is where individuals just seeking testing purely out of anxiety. And this is where most of our clients come in, without really having a medical indication. And people who are not emotionally prepared to receive the complex or potentially uncertain results. Because crucially, the genetic testing should never be done in isolation. It's always a test with proper genetic counseling. Because if you do that without that, that leads to misinterpretation, unnecessary fear, or false reassurance. So your counseling ensures the right test is chosen and the results are understood in a proper context.
I think that psychological impact is one that we really underestimate. I mean, I remember speaking to Dr. Chef, one of our regular guests, about this in the past when it comes to the sort of data that people get from, say, their watches or from their Aura rings, that for some people this can be hugely empowering and can help them make really positive changes. And then for other people, it can really feed that health anxiety and make them quite fearful. And I wonder, in the same way, what you would counsel to people who are maybe considering undergoing testing just because they think they want answers. How do you know when you speak to people in your clinic if someone is coming for a good reason, or if someone is maybe at risk of becoming very anxious as a result of anything that they find out?
If I be honest, it's literally a good detailed intake from them. And that's only how you kind of estimate or understand whether are the right candidates or not. Because as you rightly said, the psychological impact of genetic testing is often underestimated. And people would come to us saying, hey, my family member has done it, or my friend has done it. Could you please do it for me? But really, the impact varies from person to person, because some would get this knowledge as empowering, as it motivates proactive screening, lifestyle changes, and some significant preventive strategies. For others, it could provoke chronic anxiety and an unnecessary stress and feeling of doom. So, like, why bother? It's just my gene. So why should I do anything? So really, it's a good intake, creating that rapport with them and understanding where this information will take them, and is it actually going to be useful. And that's why, for me, the genetic counseling is not optional. It's really a non-negotiable for me, because pre-test counseling helps people assess their emotional readiness, which they could have underestimated, while the post-test counseling helps them process their results constructively, to be honest. And we also need to acknowledge the final dimension, the family dimension, because see, the genetic information we're getting doesn't just belong to you on its own. It has implications for your children, siblings, relatives, and that adds another emotional layer. So ultimately, genetic testing should receive, or be undertaken very thoughtfully, and you have to choose the right candidate, do all your prerequisites, and then offer it to them. That's crucial, in my opinion.
And just before you joined us, we were talking to Sophie Smith from Nabta Health about sort of the healthcare picture, particularly as it affects women, and the idea of preventative care and lifestyle to stave off ill health. And I wonder, how powerful do you think this shift towards genomic and DNA testing could be in helping people really take ownership of their health and their sort of future well-being?
So see, I mean, what I've seen is a shift already where, patients and clients are actually making those changes with or without those information. So I can see what I was seeing my patients 10 years ago, you can see that shift already. So the knowledge is there. Now, if you have that information, which hopefully they're chosen to get, they are ready to make the change. I mean, to be honest, I am my big part of my prevention, or my patients are I do lifestyle in oncology patients. Yeah. So even when I do it with them, they are like, I wish I knew it before, or they are ready to make those all the changes which I'm talking to them about. So I feel if you've got the right person on board and you're telling them and you're with them taking that journey and being honest with them, they are ready to make that change, in my opinion. I've yet to find someone. I mean, of course, changes can take time. They bounce back. It's sometimes like a yo-yo. But most of them are ready to take that leap if you are working with them. It's not you just diagnose them and leave them with a plan. You have to, I always tell my clients, I'm taking this journey with you. If you're ready to take it with me, I'm going to be there with you throughout the journey. So I think that's what makes the difference, in my opinion.
And it's so lovely to hear sort of some really positive health news as well, because the potential here for changing the way that we do sort of future plan, I guess, for our health is so remarkable. I think it's incredibly interesting. We're really just getting started with it. I'm sadly out of time with you, but I suspect that this is a topic we will return to again very soon because it is truly fascinating. In the meantime, if anyone listening would like more details for Dr. Rahat and her team at Pura Longevity Clinic at Sheikh Shakhbout Medical City, send me the words DNA on the text 4001 or on WhatsApp 04871 5500 and I can send you the details of the team there. Dr. Rahat, thank you so much for joining us today.
Thank you so much for having me.